I think one of the biggest priorities for a stroke patient after having a brain injury is how do I get myself back to where I was or as close to that as possible? So really, in a word, it's navigating the system and trying to find a way for patients to be able to ask questions or have a point person that will allow them to figure out what the next steps are on the road to recovery. The way a disease program like this can affect patient outcomes is in a couple of ways. One of the biggest goals is to make sure that patients who have stroke, we prevent them from being readmitted for this kind of diagnosis. One of the big ways of doing that is self-management and self-care. Being able to have a stroke survivor understand and recognize their symptoms, to be able to live with them, navigate through them, knowing these kinds of self-care type of things is really important.
What is the value of a disease program for an agency?
Being involved with a program like CHAP allows the agency to set itself apart within the industry. How does it do that? Plain and simply by providing high quality care. When you review the standards, you begin to see that there are symptoms and aspects of stroke care that are emphasized that might otherwise be undervalued in agencies that may not be involved with the CHAP process. And one thing that I really love and appreciate, especially as a provider, is how much there's an emphasis on family involvement to push towards this goal of stroke recovery for both the patient and the family and the agency, how they all just align themselves together. To be involved in a home health agency that's affiliated with CHAP already tells me that a patient is getting optimal care because they're getting care that is up to date with the standards and the evolution of stroke care over time. One of my main contributions with the standards was reviewing it and looking at how we can best angle it towards a stroke practice and stroke management. Essentially looking at the evidence, the literature that's out there in stroke and in home health care and in hospice, and how can we make these standards simple and effective and relatable to both the patient and the family. The other thing too that I thought was important was being able to outline certain metrics within the standards that agencies can relate to, but also be able to use to make sure that the care that they're delivering is optimal and is progressing. And I think that's a really important thing for stroke patients is they don't want to be stagnant, they want to progress and they want to get better.